Hello, everyone. Gender equity and advancing Africa science are two things that keep me up at night. One aspect of this is equity and representation of who is actually doing the science. And without gender equity among research scientists, Africa science will never reach its full potential. Today, women still lag behind male counterparts as far as representation in science. By way of example, in Kenya, the seventh most populous country in Africa, men are still twice as likely as women to be in STEM fields. But sometimes numbers can seem a bit lofty and impersonal, so I'll give you the ground level view because I am an African woman, a Kenyan woman at that, one who's in science and who has worked alongside and mentored hundreds of other African women in science. And the stories I hear or have personally experienced are ones that belittle women scientists, that still tell them to go find a partner and raise children, and ultimately that encourages them to leave science altogether. Quite frankly, something needs to be done for women scientists in Africa because ultimately public health depends on it. My name is Dr. Christine Ngaruiya, and I'm on faculty in the Department of Emergency Medicine at the Yale School of Medicine. And today I'll be sharing with you about my project titled NCD Roads, Non-Communicable Disease Research, Capacity Building, Agenda Setting, Dialoguing, and Grant Writing Program in East Africa. NCD Roads is an intervention that I designed with a team of US and Africa-based stakeholders, including input from the US National Institutes of Health and the African Academy of Sciences, in order to address these gaps in research, particularly for women clinician scientists interested in non-communicable diseases. We hoped to accomplish this through a 2-year program, including didactics in research methods and grant writing, as well as, importantly, a focus on leadership capacity building. And these talks will be facilitated by local scientists, as well as panels incorporating funders themselves to really give the trainees a front row seat at what it is that funders are looking for, while hopefully also giving the funders the opportunity to become acquainted with and better understand the needs, interests, challenges, and priorities of some of these scientists. Ultimately, this will culminate in a certificate or degree, and we plan to implement this program with the foremost output of submission-ready research grants that will be produced by each trainee at the end of the program. As far as dialoguing and priority setting, we plan to incorporate key stakeholders from across sectors as outlined in the figure, and they will be incorporated throughout the program in order to help sustainability of the outcomes we are able to achieve. This includes formalizing the nature of the program and its content, some of which is already happening today. We will also host a mid-program meeting with the mentioned stakeholders that will be built around the participants and give them opportunity to highlight their progress, their anticipated research projects in year 2, and will also hopefully act as an opportunity to engage stakeholders in their projects. And finally, we will host a stakeholder meeting at the end of the program, which will act as a final strategic point of contact with discussions around incipient program outcomes, program continuity, and future planning, including involving other stakeholders in grant writing, center development, and so on. As far as outcomes during the WomenLift Health program, I came to the program with the objective of further nailing down a partner institution to house the program, some of the didactic work and administrative activities, as well as to secure funding. And I'm delighted to announce that I pitched the idea to a set of colleagues with whom I collaborate on other NCD work at Yale. And together we were successful in being awarded a pilot grant from the Yale Institute of Global Health to start laying some of the groundwork for capacity building efforts. In fact, at each of our own different sites, in addition to my own in Kenya, but also tying in our collective expertise to help contribute to advance each individual site. And I can say that I'm several steps closer to finalizing the partner institution in Kenya, thanks in turn to the feedback, networking, and connections that I also obtained through the program. As far as next steps, I am still currently seeking funding beyond this pilot stage to make the program a reality in its entirety. And I would like to thank WomenLift Health for believing in the vision. I welcome any interested individuals to discuss more on ways that we can partner. because as the African proverb goes, he who wants to go quickly goes alone, but he or she who wants to go far goes together. And I just wanted to leave you all with this. One of my favorite quotes on gender equity, which comes from Japan's former Prime Minister Shinzo Abe, which states that women are Japan's most underutilized resource when he was referring to advancing Japan's economy. I took the liberty of editing this slightly because the same rings true for women in academia in Africa. Let's make sure that we are utilizing, maximizing, and uplifting all of our resources equally to realize the best outcomes that we can for Africa science. Thank you.